So you have lost a little bit of bone, but as you slide down the graph, you can now reach a point where the World Health Organization, or WHO, has defined as a significant point, and that is when now you're termed to have osteoporosis.
Because we are blacks, we live in Africa where there's a lot of sun, then therefore we do not lack vitamin D and we do not have osteoporosis. But those are actually, wrong notions.
It is often called the silent disease, osteoporosis, a condition that weakens bones, making them fragile and more likely to break. Around the world, millions live with this condition, sometimes without even knowing it until a fracture occurs. But what exactly is osteoporosis? Why does it develop, and who is most at risk? Bones are the framework of our bodies, allowing us to move, stand, and support our daily activities. However, over time, they can weaken, becoming porous and brittle. While osteoporosis is often associated with aging, it is not just a natural part of growing old. It is a medical condition that requires attention, awareness, and action. In today's episode, we speak with two leading doctors to uncover the facts about osteoporosis. What causes it? How can it be detected early? And what role does cutting-edge technology play in diagnosis? One key tool in this fight is the DEXA machine, an advanced scanner that measures bone density with precision. Through expert insights, we explore the science behind osteoporosis and the steps that can be taken to prevent and manage it effectively.
My name is Dr. Thuku, and I practice here at the MP Shah Hospital. I'm a consultant radiologist, and we normally deal with imaging of the human body. Osteoporosis is a general loss of bone strength and structure among our population. And as you know, bones are very important. They are what allows us to be able to lift things, to walk, move from place to place, and it's also a big store for calcium for the body. Once you reach the age of 40, you start losing bone. At that point, you don't call it osteoporosis, we call it osteopenia. So you have lost a little bit of bone, but as you slide down the graph, you can now reach a point where the World Health Organization, or WHO, has defined as a significant point, and that is when now you're termed to have osteoporosis.
In osteoporosis, the structure of bones becomes weak and fragile due to a loss of density and strength. Healthy bone has a dense, honeycomb-like structure with small pores that provide strength and flexibility. However, in osteoporosis, these pores become larger and the inner framework of the bone thins out, making it brittle and more prone to fractures. Now, how common is osteoporosis in our country?
Traditionally, it's been thought to not be common amongst black Africans particularly. But I think we're beginning to find that that was a result of a few things, a few assumptions and presumptions that, because we are blacks, we live in Africa where there's a lot of sun, then therefore we do not lack vitamin D and we do not have osteoporosis. But those are actually, wrong notions. Increasingly, we're beginning to find that people have osteoporosis who are Africans and blacks.
For Kenya, the youth are the majority in our population, but we're now living longer. So people between the ages of 40 and above will tend to have slight bone loss, but osteoporosis really comes in from the age of 50, especially among postmenopausal women. And for men, once you reach 60, 65, you have significant bone loss. And so as a percentage, it will probably affect around 30% of the population.
There are various factors that can put one at risk of developing osteoporosis.
In women who are postmenopausal, because they're now lacking the estrogen, their likelihood of losing bone increases. Men, because they have testosterone for longer, you'll find that testosterone is going down in their 60s, and that is the time they're likely to enter from osteopenia to osteoporosis. In patients who also are on chronic medication, so one of the things that is known to make you lose bone strength is medication we call steroid.
If you have a background chronic illness like even diabetes, you're likely to come down with osteoporosis. If you have a background rheumatic disease like rheumatoid arthritis, or if you have a family history of osteoporosis, also the absence of vitamin D and calcium, you could also be predisposed to osteoporosis as well.
There are others. First, for example, you are unwell and you're on bed rest for long, then you're likely to lose bone. So for example, if you're injured or your bone is broken, quickly the body will go and put more calcium in that area which is broken. And between 4 to 6 weeks, you will have healed. So that is the amazing thing of the bone. You're able to heal your body. If that area of the body, of your bones are not getting the usual pressures which you get from gravity, then you're likely to lose bone. For example, astronauts who go to the moon, one of the biggest concern is because of the very low gravity in the moon or around the moon, they're likely to lose a lot of bone because the bone is no longer getting the stresses it gets on Earth when you're walking and all. Also, patients who take alcohol in excess. Also, smoking. So smoking actually affects you on the long run.
Many people recognize that vitamin D is important for bone health and that sunshine is a natural source of it. However, misconceptions remain as some underestimate the risk of deficiency, especially in sunny regions.
Because of the new lifestyle where we tend to spend a lot of times either indoors in offices or even in vehicles and others exposed to sun that gives us vitamin D, this is beginning to predispose us to the possibilities of osteoporosis, and I think the data on this needs to be gathered.
Osteoporosis is often called the silent disease because it develops gradually and may not show symptoms until bones become weak and fragile.
Generally, for bone loss, there's no obvious symptoms. It's only when you are probably have lost a lot of bone that you'll have the actual symptoms, which you'll be feeling lethargic. You might have specific bone pains. And those, unfortunately, can just be probably a month to 3 months before you actually get a fracture. So for patients who probably have been sliding on the osteopenic graph and are actually now entering into osteoporosis, they might actually start having some focal pain. So some patients might have pain around the hip on the lateral side, and they'll go to their doctor, and if they're not checked thoroughly, within 3 months they'll have fractured their bone just from a slight fall or just tumbling.
There was this patient we recently started treating, who had this back pain for quite some weeks and had even been to the massage parlor, to the physiotherapist, but the pain wasn't getting better. When the patient came in, we thought, okay, let us investigate and find out what this back pain is. And lo and behold, this patient had, some weakened bones, from, some multiple myeloma condition. So sometimes they come as a back pain, and you might just think, oh, maybe it's my sitting posture and all of that. But at a certain age, or if you have a certain underlying condition, it should be looked at. Again, another way in which we may present is the person is losing height, getting shorter. And sometimes people will say, oh, because the person is getting older, or the person you think the person is stooped, but what's happening is what we call a compression fracture. The bones of the back are reducing in height, so that's what we call a compression fracture. And that is what will cause the person to look as though he or she is getting shorter.
Coming up after the break.
A lot of people nowadays are doing supplements. Mm-hmm. So there are people who are already taking vitamin D supplementation, especially yes. On social media, you're seeing various health gurus saying, start taking vitamin D, start taking this and this. Mm-hmm. So should people just take vitamin D like that, or should they do it under the care of a doctor or something to make sure that the dose is correct?
When you get to a certain age, a lot of times people just say, just take calcium. And my question to them is, how do you know the calcium is correct, is even being effective unless you do a test?
Bones are the foundation that hold us up, yet osteoporosis can silently weaken them over time. Here in Kenya, many people may not realize they're at risk, especially with the abundance of sunshine, until it's too late. But what can be done to protect your bones? When we come back, we will have a one-on-one conversation with Dr. Thuku as we explore the DEXA machine, one of the most advanced tools for detecting bone loss. Stay with us and see you right after the break. And now for a short healthcare tip. Your bones are your body's foundation, and keeping them strong is key to preventing osteoporosis. In Kenya, where many people may not realize they are at risk, small daily habits can make a big difference. First, focus on getting enough calcium and vitamin D, both essential for bone health. Include foods like sukuma wiki, spinach, njahe, omena, and fermented milk. Since vitamin D helps your body absorb calcium, make sure you get sun exposure for at least 15 to 30 minutes a day, or consider fortified foods. Exercise is just as important. Engage in weight-bearing activities like walking, strength training, or using a cross-trainer, which help maintain and even improve bone density. If you have knee issues, low-impact exercises like cycling or swimming can still provide benefits. Avoid habits that weaken bones, such as smoking, excessive alcohol consumption, and too much caffeine. Instead, focus on a balanced diet, regular movement, and bone-strengthening exercises to reduce your risk. And if you're over 50 or have a family history of osteoporosis, consider getting a DEXA scan to check your bone density early. Prevention starts now, because strong bones mean a stronger future.
We are living in a lost and broken world, constantly bombarded by messages of hate and atrocities. But with God, we can overcome. Find hope and restoration on the go through life-changing shows on the Family Media app.
And then you will lose yourself and gain the world. And Jesus said, what good is it?
Get to stream Family TV and Family Radio 316 straight from your phone. Catch up on a show you missed or create video streaming playlists by saving and watching videos from our huge variety of shows at your own convenience. Download the Family Media app, available for all Android and iOS users on the Google Play Store and Apple Store respectively. Family Media, keeping Jesus on the airwaves.
Welcome back. Before the break, we uncovered the silent threat of osteoporosis and why it is a growing concern here in Kenya. But how can we detect bone loss before it leads to fractures? In this next segment, we have a discussion with Dr. Thuku for an in-depth conversation as we explore the DEXA scan, a powerful tool that helps assess bone health. Stay with us as we take a closer look at how early detection can make all the difference.
For sure, there's a growing trend amongst young ladies. You know, there's the whole thing of being light skinned in Kenya and everything. So one of the things they do is they avoid the sun. You see people going out and they have a hat, they have long sleeves. So we are sort of doing the opposite because we need the sun. So how is that affecting ladies, and what would you advise?
So the good thing is, if you're in your 20s to 30s, you're in your peak strength. So that time you're really essentially bulletproof to a lot of things. So you can eat a lot of stuff, but most of the time you'll probably exercise it away because you are very active. And that is why you'll eat a lot of things, you'll get vitamin D in different ways. So it's not just the sun. But once you reach in your 40s and you're not as active, then now those factors come in. So the alcohol takes longer to be taken out of your body. If you're a smoker, it has bigger impact on your health, not just your lungs, but also your bones. And if you now don't get the vitamin D in your diet and you don't get the sun, then that is double whammy, so to speak, because the sun is free, but if you don't want the sun, then you'll have to get the vitamin. Yes.
Also, another trend is a lot of people nowadays are doing supplements. So there are people who are already taking vitamin D supplementation, especially on social media. You're seeing various health gurus saying, start taking vitamin D, start taking this and this. So should people just take vitamin D like that, or should they do it under the care of a doctor or something to make sure that the dose is correct?
So supplementation is actually a very political thing at the moment, because a lot of people who are not based as healthcare workers are starting to give this advice and these supplementations. And these supplementations, we have to be careful because they have to be regulated, so that if I give you a certain capsule, I know that actually it has the dose it says it has. So those things need to be looked by our poisons board to ensure that they match the regulations. The other things is some of these supplements, they are known to be healthy foods. So let's say you take flax seeds, you take other things, then it's known that it will help you get a certain ingredient. But some of them are not known. So you have to be careful as to what is being given to you. So yes, vitamin D is good, but then you have to get it in the right doses. Because we also say that if you get something that is too much, then now you also affect your health, because it's a balance. So you want things to be balanced. So yes, we know vitamin D is good, we know vitamin A is good, but once you take excessive of something, then you'll have problems. So for example, like in pregnant women, we don't want them taking vitamin A. That's because vitamin A can cause problems with the growth of the fetuses. So you see somebody who is not a medic and gives those pregnant women such a thing, then you have a problem down the road, and the problems can be quite serious because it can even involve malformations. So it is important that we adhere to what is known and what has been researched so that it's correct. Even B complexes are being given a lot by a lot of people, but you take those B complexes for 3 months continuously, you'll also get burnout, which is not good. So the effect will not be as good as it was there. So even for those things, they're usually given for a short period and then you stop. But the most important thing is to ensure that your diet has all these things. And that's why it's also important to take nuts. So you talk about ground nuts, about cashew nuts. All these things which are also cereals are important because they can give you all these nutrients that you need.
Early diagnosis is crucial to prevent severe bone loss and fractures in osteoporosis. Doctors often use several methods to assess bone health, detect disease, and determine fracture risk.
This is a machine we call the DEXA machine. So it actually has an X-ray beam that has 2 energy levels, and they pass through the body and they're able to pick a lot of information. So the X-ray comes from below and is detected by this machine, and it normally gives a small radiation dose. The good thing to know is that this is one of the machines that produces the least amount of radiation in the market as concerns the imaging of patients. So it is actually equivalent to 2 days of just getting radiation from the sun and other places. So the radiation is really, really low. And it is the one that is normally used to scan. So there's an arm that moves along the patient, and we come to the level of the hips, and we're able now to take the imaging of both hips, and also we take on the spine, the lower spine, and that is used to calculate how the bone strength is. The other important thing that it can do, as we were discussing earlier, is that it can be able to tell you about the visceral fat and what is the importance of visceral fat. So visceral fat is one of the indicators that are now known to be very important in determining whether you'll have other problems like diabetes, as an example, or as now we say, being obese, because being obese can bring you many other problems, from heart diseases to diabetes and so on. So it's able to confirm that it's visceral fat as opposed, let's say, to the subcutaneous fat. So it gives you now those readings, and those readings are actually more accurate than the body mass index that we normally do. It is also important in telling you how much lean body weight you have. So not only your fat, but also how much muscle you have. And this can be very important for sports people. So if you're training and the person training you wants to know your symmetry, whether your right and left are equal, this is one of the machines that you can use. It is also used to also just check your body weight very accurately. But
when somebody's laying down?
yes. So this is the arm that moves from head all the way to the toe as it scans you. So it is able to get all that information. If you are getting older, you might get more fat and less muscle. So once you see that your muscle has decreased below a certain place for your height, then the doctor can recommend some specific exercises.
And so, who is this machine most suitable for? I know you've said the sports people, but
Yes.
with regards to age, when people need to now start checking their bone health, when would be the right time to come?
We say people over 50 years going and above are the ones who are most likely needed to do this exam. But if you're on chronic medications, maybe you're being seen by a rheumatologist, you might even come in your 30s, for example. The other group of patients are patients maybe who are obese.
Right.
So your nutritionist has planned for you a regime on how you'll be able to reduce your weight. So before you start on the treatment, you get a baseline measurement to tell you this amount of fat you have, this amount of lean muscle you have, and after 8 months, we will check on you and see whether there's been improvement or not.
And if someone has metal in them, you know how when people get injuries, sometimes they put metal. Can they use this? Because I know like there's some of them they can't.
Yes, that's a very important question. So one of the things before you come is we ask you whether you have any medical conditions, whether you have metal inside you. And because you know, for example, let's say one of your hips has metal, we'll use the other hip. If both hips have metal, then we can use your arm. So you can be able to see your forearm to be able to get the bone density in you. And we can be able to omit areas which you have scanned and they have this bone. Because of course the metal will make the bones look very hard, which they're not. So we're able to omit them.
The treatment of osteoporosis focuses on strengthening bones, preventing fractures, and slowing further bone loss, and is achieved through a combination of various factors.
So typically, we give certain medications that help to put back, some of the calcium back in the bone, and reduce, some of the underlying mechanisms. So these help alongside replacing the calcium and the vitamin D required for strong bones to build the bones back and reduce the risk of a fracture, which is the major concern with osteoporosis.
So one of the important things is once you have said that the patient has osteopenia and they're going into osteoporosis, or unfortunately they're now osteoporotic, you now really want to strengthen their bones. So according to the WHO levels, there is a range. So if they're slightly osteopenic, you might just tell the patient to take vitamin D because it means maybe they're not basking enough. You add calcium to their diet, and for most that is actually enough for them to start building back their bone strength. You also tell them to be careful to start doing a bit of exercises. As you're sliding down the scale towards now osteoporosis, we are working very hard that you don't enter into osteoporosis. You can think of osteopenia just being above the water, and you can just be on the shallow end of the pool. Then as you're coming now to osteoporosis, you are almost going to the deep end, and your likelihood increases of drowning, especially if you don't know how to swim. And if you now go into osteoporosis, you're essentially saying you're underwater, and we want to rescue you so that you actually don't drown. In this case, you don't get debilitating fractures. So when you're near osteoporosis, your doctor will be very aggressive in your treatment, and they'll use drugs like biphosphonates. We also advise you that you make your house to be safe, so that if there is anything that is likely to make you trip and fall, you remove those things. If maybe you are in an upstairs house, you might be asked perhaps, can you get maybe a ground floor place, because those are the places where you might actually have a fall and fracture.
Preventing osteoporosis is crucial because it helps to maintain bone strength and reduces the risk of fractures, which can lead to long-term pain, disability, and a diminished quality of life.
I remember I was at an event recently, and there were quite a number of people who were advanced in years, and I mentioned that typically when you get to a certain age, a lot of time people just say just take calcium, and my question to them is, how do you know the calcium is even being effective unless you do a test? So you need to also check your serum calcium. You also need to check your serum vitamin D.
We should be careful of what we eat. So our diet becomes very important in essentially building up our muscle and our bone. So having enough protein is important for building your bone. The other important thing is exercise. Have a small weight. So it's not a matter of having 60 kilograms weight, which is actually not recommended and doing alone. It's something as low as just having 2 kilos or 1 kilo that you can lift, and you do it in a regular manner, and you do on both sides.
As we've seen throughout this episode, osteoporosis is not just a condition of aging. It is a silent threat that can affect anyone. But the good news is, with awareness, early detection, and the right lifestyle, we can take control of our bone health. From the expertise of doctors to the personal experiences of those living with osteoporosis, one thing is clear: prevention and management are within our reach. Thank you for joining us on this journey. Keep prioritizing your health, stay informed, and take those small daily steps that can make a big difference. Until next time, take care and stay strong.